So, one of the questions that we get asked very often is, do I need to do a brain map? A brain map is also referred to as a qEEG. It's a quantitative electrocephalograph. So, yes, before we would start any type of neurofeedback, I would like to do a brain map. It's a diagnostic tool. Just like any other doctor, when you go in, you will not be told what medication to take or how to help yourself until we run a test. In the world of neurofeedback and psychology, the way we would start a program is first do a diagnostic test, look inside your brain and see where are the challenges. Everything that you're experiencing actually has a frequency and a location. On this website, you will find brain maps that show different parts of your brain and their coordinated functionality. In other words, what part of your brain controls your eyesight? What part of your brain controls your emotion? What part of your brain controls your memory? All of these are charted out through 30 plus years of experience. We have found what part of your brain controls what behavior. So, if you're having challenges with your memory, or if you're having challenges with your behavior, or anxiety or depression, we can actually trace it back to a location in your brain and a particular frequency. There are 5 common frequencies. When we do the map, we're able to locate the frequency and the location in the brain, and we can find out where the cause of your symptoms may be. So, yes, it's very important to do a brain map before you start any kind of treatment, if at all possible. We can start a psychology regimen, we can start a cognitive behavioral program or talk therapy based on symptoms. But it's always recommended that we get into the actual functionality of your brain. Very often, cognitive therapy alone, where we talk, is insufficient because there has been a change in the structure of your brain over time. Or you may have been born with a genetic disposition or a genetic way of functioning, something that you inherited. You can inherit a genetic way of brain function. So we like to do a qEEG or a brain map to make sure that we are addressing the cause and not just the symptoms of what you're experiencing. So join us and learn more about the qEEG, which allows us to make exact decisions before you start any type of treatment.